Brushing and flossing are an important part of your daily hygiene, but does doing those things completely protect us from gingivitis and gum disease? I want you to welcome back to the program Dr. Dwayne Keller from Keller Professional Group and his patient, Carol Stelmach. Dr. Keller, welcome back.
Thank
Carol,
you, Ken.
welcome to the show.
Thank
and you
you,
watch
Ken.
the show, right? You told me?
I do.
Oh, that's awesome. We're so glad you're here. I don't want to get in too much about some of this recent stuff that came out about flossing, maybe not as necessary or as helpful as we think, but good dental hygiene is still important, correct?
Absolutely, absolutely. Bacteria cause the disease. If you don't clean up the bacteria, control and manage those, then you end up with a disease.
Right, and that gum disease can be devastating if it's not kept in check.
Well, and it's not just now in the mouth. What
Right.
they're finding is that there's so many systemic diseases that are related to the oral disease.
How do you determine if somebody has gum disease?
Through an examination, we measure the pockets of the patient. They should be 3 millimeters or less. There shouldn't be any bleeding. What you're looking at here is actually Carol's probings before we treated her. You can see all the red lines are those areas that are outside normal. And this is prior to treatment and where there was bleeding. And now you're looking after the treatment. The fact that because she can control the bacteria, she doesn't have the disease anymore.
So the pockets aren't as deep. Is that what
Correct.
should take away from this?
And there's no bleeding.
And there's no bleeding.
Right.
All right, Carol, you had some problems that led you to Dr. Keller. Tell us about
I
those.
did. My dentist identified some periodontal issues that I was having. I went to a periodontist that she recommended, and his solution was to pull 3 perfectly good teeth, 2 surgeries, $8,000 later, and that was going to be the start of the solution. I went to Dr. Keller, and
Thank goodness.
thank goodness, I started using the trays, and you just saw the results.
So this is a pilot program that Carol was involved in, is that right?
What we were doing, we were actually taking samples of the bacteria before, during, and after treatment, and now we can actually show that we can change the composition of that bacteria by changing that microenvironment so that what Carol ends up with are bacteria that don't cause the damage anymore.
All right, can you, there's a Perio Protect method? Is
Yes,
that
sir.
what you call this?
It's a Perio tray. It's a tray that she puts medicine in, wears it for about 10 to 15 minutes, and it's a very mild hydrogen peroxide gel, which actually pumps oxygen down into that area. And that environment then is changed so that the bacteria that used to be there are no longer there.
And the good replaced by good bacteria.
Correct.
So let me just take a wild guess here, Carol, and say that you went from being stunned and devastated, sitting in the chair thinking, A, I'm going to lose teeth, and B, it's going to cost me about $8,000. And fortunately wasn't the kind of person I would be where I'd say, okay, do what you got to do, you know, because you're a dentist, you must know what's right. And nothing against that particular dentist, but you got a second opinion. And what a relief that had to be, and how much it helps the budget too, I'm guessing.
It truly did, and the trays, in addition to helping the medical issue, makes your mouth feel very clean, and I think my teeth look whiter.
I was just going to say, I'm thinking,
Are
why
they
wait until you get diagnosed with something bad? This seems like a healthy thing to do, so we're going to hear more and more about this. Thank you so much, Dr. Keller, for coming in.
Thank you,
Carol,
Ken.
good to meet you. Thank
you,
you for coming in
Ken.
as well. If you're experiencing any of these problems, call Dr. Keller at 314-638-4190, or you can always check out his website, drdwaynekeller.com, to learn more about the Perio Protect method.